Good afternoon. Welcome to Pastor Tom's Devotional. We're back again about 6 months into the COVID-19 crisis, which was the reason why we started this Pastor Tom's Devotional as a matter of getting information out to everybody who was committed to working at home and locked in and locked down. So how are we doing? Well, according to Maricopa County, only 4% of people being tested are testing positive. And for example, today, not in the state, because it's less, Dane County, the last time I looked, had 216. That means out of 5 or 6 million people, 216 were diagnosed with the virus. How many of those people go to the hospital? Well, that's actually the most important question. We know this virus can make you sick. How sick does it make you, and how many of those people end up in the hospital? Well, that looks like around 20 right now for the last 10 or 15 days. 20 people out of 6 million people are put in the hospital. How many of those go to intensive care? About 3 or 4%. As of yesterday, the amount of intensive care beds being used for COVID-19 was 8%, 7 or 8%. Relatively low number. And the reason why that's high is because if you get to the ICU, you're going to be there for a while. It's kind of the choke point of this whole situation. So Arizona's doing good. Our spikes are down. We didn't flatten the curve, we demolished it. That's for sure. We've been back here at church and we've had 0 transmissions that we can track during anything that we've done since we've opened the doors after the governor allowed us back. 0 transmissions. We transmitted to pastoral staff and admins on one day. 5 people got sick. They got well. None of those went to the hospital. It was pretty light. Now, the big news is that President Trump was diagnosed with COVID, his wife, and a bunch of other people that were around the prep and around the Barrett ceremony and the debate. I haven't heard that any of those were really that sick. Trump is 74 years old and not in the greatest condition. Perhaps you might consider him in great condition for a 74-year-old, but I wouldn't say he's in tip-top shape. He was hospitalized, and it looked like there was a point when his fever was making him feel really bad, but from what I hear now, he's doing very well, and we're grateful that not only he, but most of the people who get COVID-19 incur minor symptoms. The mortality or lethality of the virus is rapidly going down because we're looking at numbers. Now, we were made aware that at least some of the hospitals here in the Phoenix area are preparing for flu season and thinking that at the time that flu goes up, COVID-19 will go up too. And they're thinking 30% more than July when we had our spike. So they're bringing in the nursing staff and the people in the next few months in order to meet that projection. But it is exactly that. It's a projection. It's their best guess. I'm praying, I don't know about you, but I'm praying that it's not true, that it doesn't happen, that it isn't like that. We are noticing in the northern states as it's getting colder that a few more people, there is a spike in the virus there. And so we can potentially think that that's a possibility here. Don't know. But it does bring me to this thought. I have enjoyed doing these Monday devotionals, and it's helped me feel in contact. I really felt good, especially when not expect the asymptomatics. They're realizing now that that's not what they were. The virus pretty much off the table. So all of that said, this is going to be our last Pastor Tom's devotional unless we go into lockdown again. If we go into lockdown again, if these health officials are correct and their projections are true, there'll be all kinds of measures taken by health officials and government during those times. And that will probably affect us as a church. But having my druthers, I wouldn't stop again. That's what I wish and hope and pray for. So here we are. We're in our last devotional. Thank you, Debbie, up there in Wyoming, watching this. The Valenzuela's regularly watching this. My son Spencer watching this. There's a lady up in Wisconsin, Deb Hagland, and also some other folks from the Madison area that have been tuning in. It's been grateful. I'm grateful to have you every time you make a comment, and I usually try to like it. I'm just so glad that you would join us on this journey. A good friend from Argentina has been tuning in regularly. Thanks for all of that. But I think we need to delegate our time and resources that we're taking to do this to taking care of now the people coming through the doors, because we're back, not at full strength. We are not at full strength, but we're getting there. This is the first of many of the fall breaks. So attendance a little bit down, but 2 weeks ago we had our highest attendance, getting back very close to our attendance in January. So that was exciting. We had 108 kids, so we appreciated that. So let's do our devotional. Let's spend this last few minutes together, meeting like this. We certainly have our live stream that we're working on hard to deliver good quality. We think we've got most of our technical issues resolved so that we don't get the skips and the crashes. It's been a learning experience. So grateful to the whole video team and the sound team, and basically it's an internet team too. Everybody trying to resolve issues so that we can be on the line and do it well and do it with excellence. But I just appreciate everybody's help in this. Many people with gifts and abilities have come out from nowhere, seemingly, to help us during the whole COVID pandemic, and that's been great. We still need people to help in audiovisual. And I'll just throw this out here, we have this dream. It would take much more manpower than we are using presently to not record on Saturday night, but to live stream our 9 and our 11. We just think that would be a better way to get this out. And then once we're okay and we're past COVID, and we don't exactly know when that is, perhaps making the live stream available in the afternoon Sunday, because it actually needs some time to be quality. It needs a sound engineer to go over things, and that's hard to do for